Bismillahirrahmanirrahim. Assalamu alaikum. Today my topic is allergy. We can define allergy as hypersensitivity of individual to foreign particles, usually a protein to which a specific individual is exposed. इसमें ये होता है कि हमारे पास हम एलर्जी को ऐसे डिफाइन करते हैं कि किसी भी एलर्जेंस के रिस्पॉन्ड में जब हमारी बॉडी हाइपर सेंसिटिव रिस्पॉन्ड देती है, हाइपर सेंसिटिविटी शो करती है, तो उसको हम एलर्जी डिफाइन करते हैं। एलर्जी में हमारे पास आगे वेरियस साइन एंड सिम्टम्स इंक्लूड होती हैं। अगर हम बात करें नोज की, तो जो साइन एंड सिम्टम्स अपीयर होती हैं वो होती है स्वेलिंग ऑफ नेजल म्यूकोजा। साइनसिस की बात करें तो एलर्जिक साइनोसाइटिस हो जाता है। आईज में जो सिम्टम्स अपीयर होती हैं दैट आर एलर्जिक कंजक्टिवाइटिस। ईयर्स में बात करें तो ईयर्स में हमारे पास जो सिम्टम्स ऑफ एलर्जी शो होते हैं वो फीलिंग ऑफ फुलनेस है, पेन है, ईयर एक है एंड इम्पेयर्ड हियरिंग इसमें इन्वॉल्व हो जाती है। स्किन में जो एलर्जी के सिम्टम्स अपीयर होते हैं वो है रैशेस, एक्जिमा। इसमें जीआईटी की बात करें, गैस्ट्रोइंटेस्टाइनल ट्रैक की बात करें, इफ देयर इज एनी एलर्जी सिम्टम्स तो उसमें अपीयर होगा एब्डोमिनल पेन, ब्लॉटिंग, वॉमिटिंग एंड डायरिया। Now we will talk about the allergens. Allergens are those particles which cause the allergy or which are the causes of the allergy. ये इसमें हमारे पास कोई भी फॉरेन पार्टिकल हो सकता है, कोई भी एंटीजन हो सकता है। द कॉमन एलर्जेंस इंक्लूड द पोलन, dust, various chemicals, drugs, which include some antibiotics medications. Food include milk, chocolate, strawberries, wheat, perfumes, pollens, and smoke. Now we will talk about the inhalant allergens. Inhalant allergens are those which can be inhaled through our nose and enter into the respiratory tract and cause the allergy. These could be the pollens, dust in the environment, smoke in the air, and the perfume particles. The symptoms include sneezing, swelling, swelling of nasal cavity, and eyes lacrimation. Now we will talk about the ingested allergens. These allergens are present in our food stuff. When we eat that contaminated food, these allergens are also ingested with food particles. The food allergens commonly are milk, eggs, wheat, soya beans, tree nuts, peanuts, fish, and the shellfish. The symptoms which mostly are caused by the food allergy and which affect our GIT are vomiting, diarrhea, abdominal severe cramps, hives, swelling of the intestinal mucosa, eczema, itching or swelling of the lips, uh, tongue or mouth, itching of the throat, wheezing, and low blood pressure. Now we will discuss the injectable allergens. These are the allergens which is caused by some injectable which include the injection or medication, insect sting. The symptoms of the injectable allergens include itching of the body, swelling of that particular part, difficulty in breathing, tightness in chest, dizziness. The person or the patient may go into the shock, loss of consciousness, hoarse voice, or swelling of the tongue. Now we will discuss some contact allergens. These are the allergens and they cause allergy when we contact or when we come across with a physical contact with some other person. This could be due to the jewelry, cosmetic, and it may be caused by the pets. It could also include the animal allergens. The symptoms include the itching of the skin, inflammation, redness, Now we will talk about some hypersensitivity. Hypersensitivity is also it could be also due to some allergens. There are various type of hypersensitivities. It could be immediate hypersensitivity. The immediate hypersensitivity could be due to various factors. It could be local anaphylaxis shock. It could be due to the allergic rhinitis. It could include the bronchial asthma, hives. It could be the systemic anaphylaxis. Systemic anaphylaxis is due to some allergens which can cause life-threatening collapse of the circulatory and the respiratory system. The another type of hypersensitivity is antibody-mediated cytotoxicity. It can be caused due to the cell damage. It includes the lysis of the cell. It may occur mostly due to the hemolytic disease of newborn, which is also called erythroblastosis fetalis. Another type of hypersensitivity is cell-mediated hypersensitivity. It is due to the T lymphocytes and B lymphocytes. Now we will discuss that how to diagnose the allergy. Allergy is mostly diagnosed by taking the medical case history. First of all, we will take the history of that person or that patient. Then we will go to the general examination. The general examination, in general examination, we will ask the age, the gender of the patient, type of environment where he works and live, his occupation, and any allergy symptoms. Then we will take some vital signs. Vital signs include blood pressure, temperature, breathing rate, pulse rate, cardiac output, and heart rate. This will help us a lot in diagnosing the allergy. Allergy could be tested by the skin test, also by the blood test. In skin test, we include the scratch test or skin prick test. Another test is patch test. We also use intradermal test to diagnose the allergy. Then we will lastly, in the last, we will discuss the treatment of allergy. The treatment of allergy varies from person to person and depends upon the type of allergy. It includes three types of regime. First of all, avoid the allergens. If you have the allergy from the smoke, dust, perfume, some food stuff, then avoid that particular allergen. Then we will involve the pharmacotherapy. Pharmacotherapy includes the medication. First of all, antihistamine drugs are taken. Antihistamine drugs include diphenhydramine, hydramine, and chlorpheniramine. Then we will take the leukotrienes inhibitors, and lastly includes the immunotherapy. Immunotherapy includes the allergy shots so that the person may become desensitized to that particular allergen. The duration of that medications may include 3 to 4 years for the person to be the free of symptoms. Typically, the treatment begins with injection of solution of allergen given 1 to 5 times a week, with the strength gradually increasing. It usually takes about 3 to 4 years for the patient to be free of symptoms. Thank you so much.
Please, Gavel, start.